So you are big on sedation dentistry in your practice. What are the different procedures that you're using it?
Well, Randy, we use sedation for every kind of procedure. You
Okay.
know, from deep cleanings that somebody might need to have to, you know, root canal procedures or fillings or whatever it is that they're having done. One of the benefits of having this, the sedation is, especially if you're a bit apprehensive, right? And let's face it, you know, there's a lot of people out there who, you know, this is not a fun day when they have to have some dental work done.
Yeah.
And certainly, you know, being able to come in, have the sedation, rest comfortably through the procedure, really have almost no memory of what went down, and we can use this to fix whatever it is that needs to be fixed. If, you know, in my practice, there's multiple doctors, and a number of us are trained in sedation. And so whether you're having wisdom teeth out, whether you're just having a cleaning and some fillings done, you know, it's kind of nice to come in, rest comfortably, have your work done, and you get up and you leave and it's all done. And this is where we're using it a lot. And especially when we're doing, you know, more invasive procedures, more surgical type of things, the implantology, you know, the reconstruction stuff that we're doing, people really like it. Even the ones who aren't apprehensive, you know, they come in and that's not a bad day when you can get all your work done, they go home and it's all done.
So when you say things like, obviously for the dental phobics, it's great, but for the people that are just busy, you know, they got kids and this and that, you're able to do what would maybe take you 4 or 5 visits all in one day.
Absolutely.
Is that right? Because
yeah,
of sedation?
absolutely. Because, you know, how long can you realistically sit in the chair awake holding your mouth open, right? You know, it gets uncomfortable after a while. So especially for longer appointments, we can do more in one sitting. You know, if you're a very busy person, I have a lot of CEO types who are patients of mine, and that's the way they have their dentistry done. They don't have time to come to me 10 times. They just want to, boom, they want to come in, get it done, be on their way. They've got other things to do.
They're probably happier, right?
Much happier.
Because they, you know, it's just a relaxing situation.
Absolutely.
So you offer all levels, like nitrous, a pill, IV sedation?
Personally, I only work with IV sedation. Okay. So, you know, what the public needs to understand about sedation is that it's a continuum. So it's from conscious, like us sitting here right now, fully conscious, all the way down to general anesthetic, which they would use in a hospital. If you're having a heart operation, obviously they can't give you a little bit of freezing here and, you know, or anesthetic and do your operation. They got to shut you off. Okay. And that's what general anesthetic is. Intravenous sedation sits up in the conscious sedation. So you're not intubated, you're breathing on your own. You know, you're
being monitored though the whole time.
You're being monitored, of course, but honestly, it's so safe of a procedure because we're not doing deep sedation. It's moderate sedation. That's where we're at. It's called moderate. So, you know, in the no sedation, light sedation, moderate sedation, deep, then general anesthetic.
Must be easier for you though as a doctor and easier on the patient when you have somebody that's totally relaxed.
Absolutely.
Right?
Absolutely. You know, if you're in the chair and you're having a procedure done, say a surgical procedure, a tooth being extracted, or implant surgery, whatever it is that you're having done, if you're stressed, even if you're mildly stressed, you know, your body is putting out chemicals because of this stress that, you know, your blood pressure is increased, right? There's a lot of things, you know, you're gonna have more bleeding, you're gonna go through the anesthetic much quicker, which means you're gonna have to have more, you know, more anesthetic injected, and the whole procedure can be very uncomfortable. So when we're using sedation, generally, I'm anesthetizing the patient once, and for 3 hours, they're going to be numb. Versus if they were not sedated, I'd have to freeze them maybe 4 or 5 times in the same appointment because they're going through the anesthetic faster. Their system is in a higher gear. And so it is much better for the patient, much better for the doctor. They heal better. They're not producing those stress chemicals in their body that cause more inflammation, you know, post-operatively. So people who are relaxed during the procedure also have a much better time of it post-procedure.